So how does someone get started with stem cell therapy? Well, it all starts with stem cell banking. Let's talk about it.
As you know, Dr. Guillory, Celtex can create a potent and pure bank of one's own mesenchymal or master signaling cells. This is done through extensive quality and sterility testing up in the lab. We have three teams that compose our lab team. We have a manufacturing team, quality control, and quality assurance. So there's checks and balances throughout the entire process. From that adipose or fat sample, the lab is able to isolate those MSCs and then culture them up to create what we call a foundation bank. And then they can continue culturing those cells for therapeutic purposes. And this notion of a foundation bank is that from a single extraction, because of the lab's ability to culture the cells, that single extraction essentially affords a lifetime supply of stem cells that are cryopreserved and basically called upon if and when you need them for general therapeutic purposes. Dr. Guillory, can you just describe to the audience your thoughts on why are high doses of stem cells important, and why is it important to work with stem cells from your own body versus from some foreign donor source?
Yeah, so obviously there are benefits of all options. I mean, I like the fat-derived cultured cells for a lot of reasons. One is I feel like they're certainly easier to get than the bone marrow derived cells, and they do have some unique benefits. But for the main reason somebody would get their own cells is because there's no risk of rejection, there's no risk of reaction, there's no risk of infection if you're using your own cells as compared to a donor product. The donor products on the market today, it's sort of a little bit of the Wild West. There are some great products out there, but with the way the regulatory environment is, you don't know what's going to happen. But I do use some of those products, and they're great products. The benefit of using your own cells, in addition, I think everybody should bank them because, like I said, if you bank now, and I have all my kids' cells ready to deliver, and I actually used them this year because my son tore his PCL ligament in his knee, and having those cells available for a traumatic injury, that's going to be the new standard of care in 15 years for traumatic ligament injury, spinal cord injury, and brain injury. Having the ability to have your own cells ready the very next day for whatever purpose that you might need them is a really big benefit. The other benefit is the power of the cells is often in the number. And there are a couple of patient stories that I have had personally where 100 million cells wasn't enough, 200 million cells wasn't enough, but 400 million cells was the difference between not improving and complete remission. So the nice part about having a bank where you can continually renew those cells is over time, right? If you need something next year, it's there, but also the number. So oftentimes you need just a really high number of cells to do the job that you want to do. And that's pretty plastic. So a higher number of cells, you really have to have approval of a physician thinking about your case, because we don't often give more than 200 million in a dose, but every person is unique, and I would do whatever it took to help somebody get well.